Let's go and look at the data for today. First, we'll start with the key indicators. And again, starting with the cases, we're seeing cases hover above 1,000 a day, which is significantly higher than certainly they were before. We're reporting today 1,150 new cases that we've learned about from local health departments during the last 24 hours. This is a little bit lower than our peak last week, but it's still considerably higher than where we were 3 weeks ago. This is consistent with the pattern we've seen and are continuing to see where the number of new cases is much higher than it was. Looking at the rest of the data, you'll see here the deaths the last 24 hours were where 15 of our fellow citizens. The 21-day average is 18, so that's a little bit under that. The hospitalization is up above the 21-day average. That's 81 versus a average of 70 for 21 days. And the ICU admissions is up a little bit statewide as well. And when we get to the further data, we'll kind of look at this as it breaks out by region of the state. Let's look, Eric, at the next one. And let me just also point out that these are some of these are in fact lagging indicators, certainly in regard to hospitalization. And when we get to new cases, that is even further out before we see people go to the hospital or we see them get into ICU. Let's look at the, this is the current confirmed COVID-19 patient count in Ohio hospitals by day. The previous slide depicted the number of new COVID-19 hospitalizations that we have reported. This slide also looks at hospitalizations, but it shows the daily number of COVID-19 patients that are currently in Ohio hospitals. You can see from this slide that on June 26th, for example, there were 619 COVID-19 patients in hospitals around the state of Ohio. Since then, we've increased that. And as of today, a snapshot as of today, 905. So June 26, 619, today 905 COVID patients in our hospitals in the state of Ohio. During the past few weeks, this increase has been steady, which is certainly concerning, and as we see these numbers go up. Let's turn to the next slide, which is the testing and positivity slide. We continue to increase our testing capacity in Ohio during the last few weeks. We know that testing is an important component of the ongoing monitoring of this virus. We do see a kind of a different effect, and I asked our team about this today. This is a number we look at. We have positivity numbers statewide. So in other words, of the tests that were done, what percentage were positive? Snapshot, the last day we have available, 6.4. That has hovered between 4 and 6 for some time. This is a higher number. We don't particularly like that number, but we are seeing, for whatever reason in reporting, that on the weekends, the positivity number is just less. And that may be who's getting, obviously it's who's getting tested, where they're getting tested, so we're not really sure. So the most important thing is really to look at this in a 7-day average. And I'm going to we'll try in the future not only to show you this for the day, but I think the 7-day average gives us probably a much better look at what is going on. But the positivity rate reported for July 7th, which is was 6.4%, which is Ohio's highest since May 25th. Since May 25th. Now we're going to look at the new risk level map. And you will obviously see some changes, and I'm going to go through that. We're going to do this once a week. We're doing it basically on Wednesday. Once the Wednesday data comes out, then our team starts working with that data. Our data team has been working, analyzing the data over the past week, updated the status of our counties on the public health alert system. I want to remind everyone that there are a number of different data points that we look at. 3 of the data points have to do with cases. The team looks at new cases per capita. They determine if there is a sustained increase in new cases. They look at the proportion of cases that are not in a congregate setting. Another group of indicators looks at symptoms. They look for a sustained increase in emergency department visits, sustained increase in outpatient visits, such as people going to see their doctor's office with suspected or confirmed cases. The team also looks for sustained increases in new COVID-19 hospitalizations and increase in intensive care unit bed occupancy. Additional indicators that will ultimately be factors but are not yet will include contact tracing, test per capita, and percent positivity. We do not have, for example, the test positivity broken down yet. We don't have the ability to do that by county, but we are certainly looking at that. And again, to review, counties that meet 0 to 1 indicators are Public Health Advisory Level 1, yellow. Level 2, orange, is triggered when 2 to 3 public health indicators are met. For counties that meet 4 to 5 indicators, they're listed as Level 3, which is the red counties. Once a county is at Level 3, the additional factor that then comes into play is that they cannot improve their risk level category unless cases drop below the Centers for Disease Control and Prevention's threshold for high incidence. And that is 100 new cases per 100,000 people over the last 2 weeks. For a county to be considered Level 4 or purple, a county must trigger 6 or more indicators during 2 reporting periods in a row. Once a county is at a Level 4, it cannot improve its risk level until it has not triggered 6 or more indicators for 2 consecutive reporting periods.